Welcome back to my YouTube channel. Basically, I had a lot of questions sent to me, so I decided to do another video to talk about some things I didn't cover probably in my excitement and drugged upness from the surgery. Basically, it's been 3 months since I had my operation. I've now been discharged, so I don't have to go back again. Look how wonderful it is. Look how beautiful. Isn't it fantastic? One of the questions I got was about preparing for the operation, what they told me to do beforehand. So one of the things was Arnica 30 capsules, so taking them as much as you can. And 2 every 2 hours, and then 2 every 2 hours for the first 3 days, and then it's 2 every 12 hours after that, and it worked really well. My bruising and swelling went after 10 days. So buy plenty of straws and plenty of ice poles, because when you go for the actual surgery, they obviously have to put the thing down your mouth to stop you choking and dying in tubes and whatever, and it can make your throat really raw. Mine really wasn't too bad, so I didn't really use them too much. So exfoliate the frig out of your nose and your face, because the splints on there for ages, and your skin afterwards is pretty awful, and you have to spend ages kind of healing it back, because it's just, obviously it's been under something, so it gets very kind of grubby and a bit grim. So when you come off, don't be surprised if you've got a couple of blackheads and whiteheads going on, but they go away quick enough. But if you've exfoliated it beforehand, it just makes the whole thing a lot easier. Slippers, make sure you bring slippers, because you'll be wandering around, and also, like, the hospital floors are cold. So if, like, when you go on holiday, sometimes they have those really crappy slippers in the hotel's room. They are perfect, because you can also throw them away after. It's not exactly eco-friendly, but it's the best way to do it. What the surgeon actually did, he went. I've got no scars on the outside. They go up through the inside of the nose. There's no very 80s Life on Mars scar down the centre of your nose, going in that way, chiselling it off. But essentially, that is what he did. He took out a chunk there. There's a slight dent, which gives me, when I touch it, does make me feel a bit funny. But there's a little change in the profile of the actual bone in my nose, where they've taken it off and realigned it and pushed the tip of my nose up and back a bit. So there's a small, very small upwards incline to it. But that was to make it go backwards, because they can't squish your nose up too much, because otherwise it gets wider. The anaesthesia itself is nothing to be scared of. It's again, they have wonderful anaesthetists. There we go. That'll do. That walk you through the whole process, and they're really good at what they do. So it's nothing to be scared of if you are going under. There's a whole terms and conditions things, which obviously, for the appropriate medical reasons, you always need to read and make sure that you aren't the most likely person to, like, die or never wake up from it, sort of thing. So it gave me both local and general anaesthetic, and again, it was fine. I woke up straight after, was back to normal. It really didn't faze me at all, it seemed. So that was kind of brilliant. Don't worry about bleeding. I had the big old bandages across my nose, which I was kind of leaking, for ages and bleeding for quite a while after, and I was worried it was never going to stop, but it was absolutely fine. I had very little pain throughout. Like, to be honest, I've got quite a low pain threshold. I took about 3 painkillers throughout the entire course of the thing, and the most awkward bit is when they take the splint off your nose, because that is really unpleasant, because you're very paranoid about it being on your face, and they proper rip it from side to side trying to get it off, and it just makes you shudder. It's really not pleasant. You hear lots of noises you shouldn't hear. Again, it's not too bad, and once it's off, you get all the excitement of seeing your new nose. When I first went to meet the surgeon, I walked into his office, didn't know why I was there, and the first thing he said to me was, "I know why you're here, your nose is too big for your face." Well, isn't that just wonderful to hear? But he was right, and the most flattering thing was the surgeon at the end was willing to ask for my permission to use my photos to show to other patients, because he liked it. So he likes my nose so much, and he said he finds it really difficult to get permission from males to show off people. And I'm like, I spent all this money on it, why wouldn't I show everyone? I had a lot of friends saying, "Oh, I want a nose job, I want this, that and the other." Please don't get a nose job, because unless it's something you've been thinking about for a good few years, then you don't need one. it's not something to be considered lightly, and I don't want anyone thinking it is something to consider lightly, but if you do feel that passionate about it, do investigate it. It was very nice to get probably about 50 or so questions online, and that's obviously excluding the ones I get in person. First and foremost, I've got so many compliments from my new nose, which is absolutely wonderful. But don't be surprised if not everyone noticed. A lot of my family thought I had a haircut, so swings and roundabouts on that one. But thank you very much for watching.